Part 1. Causes of back pain. Back pain is one of the most common health problems in the United States. Studies show that almost 8 out of 10 Americans will experience some form of back pain during their lifetime. It doesn't matter whether you're young or old, active or sedentary, back pain can affect anyone. But here's the good news. Most back pain has specific causes, and if you understand them, you can take steps to prevent and manage it. So today, let's talk about the 5 most common causes of back pain and explore how they sneak into our daily lives. 1. Poor posture. One of the biggest culprits behind back pain is poor posture. Think about how many hours we spend sitting, in offices, at home, or even driving. Many Americans have desk jobs where they sit hunched over a computer for 6 to 8 hours a day. Add in smartphone use, scrolling on couches, and binge watching TV, and you have the perfect recipe for back strain. When you slouch or hunch forward, the spine is forced out of its natural S shape. Over time, this puts stress on the muscles, ligaments, and discs in the back, leading to stiffness and pain. People often don't realize it until the discomfort becomes chronic. 2. Muscle strain or injury. Another common cause is muscle strain. Sometimes back pain happens suddenly. Maybe you lifted a heavy box the wrong way, tried to move furniture, or even bent down awkwardly. The muscles and ligaments in the back can easily be overstretched or torn, especially if you're not used to physical activity. This kind of strain can cause sharp pain, stiffness, and difficulty moving. Even athletes and people who exercise regularly are at risk if they skip warm-ups, overdo workouts, or use improper techniques. For the average person, simple tasks like shoveling snow in winter or gardening in summer can trigger muscle injuries. 3. Herniated or slipped disc. Now let's talk about something more medical. A herniated disc, sometimes called a slipped disc. Between each bone in your spine are soft, cushion-like discs that act as shock absorbers. When one of these discs is damaged or pushed out of place, it can press on nearby nerves. This often causes pain in the lower back, and sometimes it radiates down the legs, a condition many know as sciatica. Herniated discs can happen due to aging, wear and tear, or sudden injury. People often describe it as sharp, shooting pain that makes even simple movements difficult. 4. Degenerative conditions. As we get older, the spine naturally undergoes changes. Conditions like arthritis, spinal stenosis, and osteoporosis become more common with age. Arthritis in the spine causes the joints to stiffen and swell, leading to chronic pain. Spinal stenosis is a narrowing of the spinal canal, which puts pressure on nerves and causes pain, numbness, or weakness. Osteoporosis makes bones weaker and more likely to fracture, including the vertebrae in the back. For many older Americans, these degenerative conditions are a major reason why back pain becomes a daily challenge. 5. Sedentary lifestyle and obesity. Finally, one of the most overlooked causes is simply living a sedentary lifestyle. With modern conveniences, remote jobs, and endless digital entertainment, many of us spend hours sitting without enough physical activity. Lack of movement weakens the core and back muscles that are supposed to support the spine. Over time, this leads to poor spinal alignment and discomfort. Add in extra body weight, and the pressure on the spine increases dramatically. Obesity is a growing problem in the U.S., and it plays a big role in chronic back pain. Bonus factor: stress and mental health. Interestingly, back pain isn't always physical. Stress, anxiety, and depression can also cause muscle tension, particularly in the shoulders and lower back. People under constant stress often clench their muscles without realizing it, and this tension builds into pain. Mental and physical health are deeply connected, and back pain often reflects that relationship. Putting it all together, the truth is, most people don't have just one cause of back pain. It's usually a combination. A person may have poor posture at work, carry a few extra pounds, and also be dealing with stress. Together, these factors create the perfect storm for chronic discomfort. Understanding these common causes is the first step to taking control of your back health. Once you know what's happening to your body, you can start making small but powerful changes to protect your spine and reduce pain. And that's exactly what we'll explore in the next part: precautions you can take to avoid back pain in the first place. Backhand index pointing right. Before we move on, I want to hear from you. Which of these causes sounds most familiar in your life? Do you think your back pain is from posture, stress, or maybe an old injury? Share your experience in the comments below. Your story might help someone else realize they're not alone. Sparkles, and don't forget, hit that like button, subscribe for more health insights, and stay tuned for part 2, where we'll dive into the best precautions to keep your back strong and pain-free. Part 2: Precautions for back pain. If you've ever felt that sharp pinch in your lower back after sitting too long, or the dull ache that creeps in after a long day, you know how frustrating back pain can be. The good news is that while back pain is common, it's not always unavoidable. By taking the right precautions, you can protect your spine, reduce the risk of injury, and keep your back strong and healthy. So let's dive into some simple yet powerful steps you can take in your everyday life to prevent back pain before it starts. 1. Practice proper posture. Good posture is one of the best defenses against back pain. Think about how many hours you spend sitting at a desk, working on a laptop, or scrolling on your phone. Slouching might feel comfortable at first, but over time it puts stress on your spine. Instead, make a habit of sitting with your back straight, shoulders relaxed, and feet flat on the floor. Use an ergonomic chair if possible, one that supports the natural curve of your lower back. When standing, keep your weight balanced evenly on both feet instead of leaning to one side. These small adjustments can make a big difference. 2. Lift the right way. A lot of back injuries happen in a split second, often while lifting something heavy. The mistake most people make is bending forward at the waist and using their back muscles instead of their legs. This puts all the pressure on the spine. The safe way is simple. Bend your knees, keep the object close to your body, and lift with your legs while keeping your back straight. And if something feels too heavy, don't risk it. Ask for help. One moment of carelessness can lead to weeks or even months of pain. 3. Take movement breaks. Sitting for long periods is one of the biggest hidden dangers for your back. Whether you're at a desk job, driving, or binge watching a series, staying still for hours weakens the muscles that support your spine. Try to stand up, stretch, or walk around every 30 to 60 minutes. Even a quick 2-minute stretch can help keep your muscles active and reduce stiffness. Some people set alarms on their phones as reminders, a small trick that can protect your back in the long run. 4. Choose the right footwear. Believe it or not, your shoes play a role in back health. Wearing high heels or shoes without proper support can throw off your posture and put extra stress on your spine. Choose shoes that cushion your feet and support your arches. If you stand for long hours at work, invest in footwear that prioritizes comfort over style. Your back will thank you. 5. Sleep smart. We often forget how much time we spend sleeping, almost a third of our lives. The wrong mattress or pillow can easily contribute to back pain. Choose a medium-firm mattress that supports your spine's natural curves. Sleeping on your back with a pillow under your knees, or on your side, with a pillow between your legs, helps maintain alignment. Avoid sleeping on your stomach if you can, since it strains the neck and spine. 6. Stay active. Prevention isn't just about avoiding bad habits, it's also about building good ones. Regular exercise strengthens the muscles that support your spine, especially your core. Activities like walking, swimming, or yoga are excellent for keeping your back strong and flexible. You don't need to spend hours at the gym. Even 20 to 30 minutes of light activity most days can go a long way in protecting your back. 7. Manage stress. Surprisingly, stress is another silent factor behind back pain. When you're tense or anxious, your muscles tighten up, especially in the shoulders and lower back. Over time, this constant tension leads to pain. Practices like deep breathing, meditation, or even a short walk outdoors can help release that stress. A healthy mind often means a healthier back. 8. Watch your weight. Excess weight puts extra pressure on the spine, especially in the lower back. If you're carrying a few extra pounds, even small changes in diet and activity can ease that pressure and reduce pain risk. Focus on gradual, healthy changes rather than extreme diets. The lighter your load, the less strain your back has to carry. Wrapping up, precautions don't have to be complicated or expensive. They're simple everyday choices: how you sit, how you lift, how often you move, and even how you sleep. By paying attention to these small details, you can protect your spine and save yourself from unnecessary pain in the future. And remember, prevention is always easier than treatment. Taking care of your back today means living more comfortably tomorrow. In the next part, we'll go deeper into treatments for back pain, from quick home remedies to medical options, so you know exactly what to do if pain does strike. Backhand index pointing right. What's one precaution you think you need to improve in your daily routine? Is it posture, lifting techniques, or maybe getting more movement during the day? Share your answer in the comments. You might inspire someone else to make a healthy change. Sparkles, don't forget to like this video, subscribe to the channel, and hit the bell icon so you don't miss part 3, where we'll explore treatments that actually work. Part 3. Treatment for back pain. Even if you take all the right precautions, sometimes back pain still shows up. Maybe it's from a sudden twist, a stressful week, or simply the wear and tear of daily life. The important thing to know is that most back pain can be treated, often without surgery or complicated procedures. Let's look at some of the most effective treatments, from simple home remedies to medical options, so you know what to do if back pain interrupts your life. 1. Rest, but not too much. When back pain first appears, the natural reaction is to lie down and rest. And yes, giving your body a short break can help calm inflammation. But here's the catch: too much rest can actually make the pain worse. Lying down for days at a time weakens your muscles and stiffens your joints, which slows down recovery. Experts recommend short periods of rest, a day or two at most, followed by gentle movement. Even light walking helps keep blood flowing and prevents stiffness. 2. Hot and cold therapy. One of the simplest and most effective treatments is alternating between heat and cold. Ice packs reduce inflammation and numb sharp pain, especially after a fresh injury or strain. Heat packs, on the other hand, relax tight muscles and improve blood flow, which speeds up healing. A common rule is, use ice for the first 24 to 48 hours after an injury, then switch to heat. Many people find that alternating both works best for chronic aches. 3. Over-the-counter medications. Sometimes pain needs a little extra help. Over-the-counter medications like ibuprofen, Advil, or acetaminophen, Tylenol, can reduce pain and inflammation. These are generally safe when used correctly, but they're not meant for long-term use without a doctor's guidance. It's important to follow the instructions on the label and avoid combining multiple pain relievers unless approved by a healthcare provider. 4. Gentle stretching and exercise. It may sound counterintuitive, but movement is often one of the best treatments for back pain. Gentle stretching, yoga, or physical therapy exercises can strengthen the muscles that support your spine and improve flexibility. For example, knee-to-chest stretches, cat-cow stretches, bridges to strengthen the core. Child's pose for gentle relief. Consistency is key. Doing a few minutes of stretching daily can make a noticeable difference over time. 5. Physical therapy. If back pain is persistent, physical therapy can be life-changing. A physical therapist designs a personalized program of stretches, strengthening exercises, and posture correction. They may also use techniques like massage, ultrasound therapy, or electrical stimulation to ease pain. Unlike quick fixes, physical therapy teaches you long-term habits that prevent pain from returning. 6. Alternative therapies. Many Americans turn to alternative treatments, and for good reason. They often provide relief without medication. Some of the most popular include chiropractic care, adjustments to align the spine and reduce nerve pressure; acupuncture, tiny needles stimulate points on the body to relieve pain; massage therapy, relaxes tight muscles and improves circulation; yoga or Pilates, build core strength and improve flexibility. These treatments don't work for everyone, but many people find them helpful when combined with conventional care. 7. Medical treatments. For more severe cases, doctors may recommend stronger treatments. These can include prescription medications for severe inflammation or nerve pain, injections such as corticosteroids to reduce swelling around nerves, surgery, in rare cases, for issues like herniated discs or spinal stenosis that don't improve with other treatments. Most people will never need surgery, but it's reassuring to know options exist for serious conditions. 8. When to see a doctor immediately. While most back pain improves with home care, there are red flag symptoms you should never ignore. Seek medical help right away if you experience severe pain that doesn't improve with rest, numbness, tingling, or weakness in your legs, loss of bladder or bowel control, sudden, unexplained weight loss along with back pain. These could signal a more serious condition that needs urgent treatment. Wrapping up, the truth about back pain is that there isn't a one-size-fits-all cure. What works for one person may not work for another. The key is to combine treatments: a little rest, some heat or ice, gentle movement, and professional help when needed. Most importantly, listen to your body. If something feels wrong, don't push through it. Early care often prevents small problems from becoming big ones. In the next part, we'll explore something equally important: lifestyle and dietary changes that can protect your back for the long haul. Because while treatments are great for short-term relief, your daily habits are what keep your spine strong and pain-free for years to come. Backhand index pointing right. Have you ever tried hot and cold therapy for back pain? Did it work for you? Share your experience in the comments. Your tip might help someone else find relief. Sparkles And don't forget, like this video, subscribe to the channel, and click the bell so you don't miss part 4, where we'll talk about lifestyle and dietary fixes that make back pain less likely to return. Part 4. Lifestyle and dietary modifications for back pain. Back pain may start suddenly, but preventing it from coming back is a long-term process. Lifestyle choices and diet play a powerful role in keeping your spine strong, flexible, and pain-free. Let's break down the most effective changes you can make starting today. Lifestyle modifications. 1. Maintain a healthy weight. Extra body weight, especially around the midsection, puts constant pressure on the lower back. This stress can worsen pain or trigger issues like herniated discs. Losing even 5 to 10 pounds can make a noticeable difference. A balanced diet and regular exercise help manage weight and reduce spinal strain. 2. Stay active daily. Sedentary lifestyles are one of the biggest causes of chronic back pain. Long hours of sitting weaken core muscles and stiffen the spine. Aim for at least 30 minutes of movement daily. Brisk walking, cycling, swimming, or light jogging. Low-impact activities are easiest on your back while keeping your body strong. 3. Practice good posture. Posture isn't just about standing tall, it's about protecting your spine. Whether sitting at a desk, driving, or standing, keep your shoulders relaxed, your chin slightly tucked, and your back straight. Tip: invest in an ergonomic chair and adjust your computer screen to eye level to avoid hunching. 4. Sleep the right way. Poor sleeping positions can worsen back pain. Sleeping on your stomach strains your spine, while sleeping on your back with a pillow under your knees or on your side, with a pillow between your legs, can align your spine naturally. A medium firm mattress usually works best for spinal support. 5. Quit smoking. Few people realize smoking damages spinal health. It reduces blood flow to spinal discs, making them more fragile and prone to injury. Quitting smoking not only helps your lungs and heart, but also reduces your risk of chronic back pain. 6. Stress management. Stress makes your muscles tense up, especially around the neck and back. Over time, this tension leads to stiffness and pain. Techniques like deep breathing, meditation, yoga, or simply taking breaks from daily stressors can make a big difference. Dietary modifications. Your diet directly impacts inflammation, bone strength, and overall spine health. Let's look at foods that help and those that hurt. 1. Anti-inflammatory foods. Chronic inflammation is a hidden driver of back pain. Adding these foods to your daily meals can calm inflammation naturally. Fatty fish like salmon, sardines, and mackerel, rich in omega-3s, leafy greens like spinach, kale, and collards, nuts and seeds such as walnuts, almonds, and flax seeds, berries like blueberries, strawberries, and cherries too. Bone-strengthening nutrients. Your spine relies on strong bones and discs for support. Nutrients like calcium, vitamin D, and magnesium are essential. Include low-fat dairy products or fortified plant-based milk, eggs, fatty fish, and mushrooms for vitamin D, whole grains, bananas, and leafy greens for magnesium 3. Hydration. Spinal discs are mostly water, and staying hydrated keeps them flexible and cushioned. Dehydration makes discs dry out, leading to stiffness and pain. Aim for at least 8 glasses of water a day, more if you're active. 4. Limit inflammatory foods. Certain foods trigger inflammation and worsen back pain. Try cutting back on processed foods high in sugar and refined carbs, deep-fried foods, and trans fats, excess red meat, and processed meats, too much alcohol and caffeine. 5. Maintain a balanced plate instead of restrictive diets. Focus on balance. Half your plate fruits and vegetables, a quarter lean protein, and a quarter whole grains. This approach fuels your body while keeping weight in check. The bigger picture treatments and medications may relieve pain temporarily, but real prevention comes from daily habits. By combining healthy posture, regular activity, stress management, and a spine-friendly diet, you create an environment where back pain has little chance to return. Remember, small, consistent changes often lead to the biggest results. Swap one processed meal for a healthier one, take a 10-minute walk after dinner, or try replacing soda with water. Over time, these little steps build into a lifestyle that supports your back for years to come. Backhand index pointing right, and that wraps up our 4-part journey into back pain: causes, precautions, treatments, and lifestyle fixes. Speech balloon before you go. Which of these lifestyle tips do you want to try first? Let me know in the comments. Don't forget to like, subscribe, and hit the bell for more health and wellness videos.